can kind of almost feel your adrenaline pumping and...
Okay, so you probably have your heart going a little bit faster, and sometimes...
The fight and flight.
Yeah, those fight and flight feelings of stress that cause increased breathing. You're probably a little perspiration sometimes go along with that. You know, you had mentioned that earlier that you try hard not to show the stress, but it's all building up inside.
Yeah.
And you try to hurry the patients too much, because you know you want to meet the demands of all the other patients as well. You want to get your work done, and it can be frustrating. And everybody wants something all at the same time. It never fails.
Okay.
So you just do, and you have to, just go with it.
Okay. How do you feel? What symptoms does your body give you that you're under a lot of stress?
My muscles get kind of sore once in a while, and then I just need to sit down and relax for a little bit.
So it's some aches and pains that you experience.
Yeah, mostly in the lower back.
Any of you ever take your stress home with you? Does that ever happen where some of the way you are at home might be different when you're under a great deal of stress?
Yep.
Can you give an example?
You have less, you don't have the patience, might not have patience with your children, with your significant other.
Yeah, with your husband.
Sometimes you have to catch yourself so that you don't lash out at them. You have to stop and think, hey, wait a minute. But sometimes it's really nice. They're real understanding, and you can vent towards them. And sometimes they vent their bad days they've had too.
Okay.
It can be very helpful.
Okay. I'd like to find out what helps when you're feeling a great deal of stress on the job. What are some of the things that you do for yourself that make the situation better? Anybody want to start?
I'd definitely say to walk away from the situation as long as the patient's safe. Always ask for help. Go to the charge nurse, sort of things.
And how can
relieve the stress.
Yeah, how can the charge nurse help you if you're having a lot of stress? What kinds of things might
Well, they can definitely help you out if you need something, if you need help turning a patient or, getting them up with, sometimes these patients take 3 to 4 people to get them out of bed. You need to ask for help just to relieve that stress of trying to get everything done. Sometimes you can't, so just go find some help to help you with that.
Okay. Anything else?
Just taking deep breaths. It relates to the physical stress, using good body mechanics, using your gait belt, bending with the knees so you're not, putting a lot of pressure on your back. And if you're taking care of the patients in bed, keeping the bed elevated so you're not bending over and putting a lot of stress on your back.
Okay. What are some things that you do outside of work? Are there things that happen that help in the situation when you're away from the job?
Well, I like to exercise, go to the gym. That helps, making sure you have time for your friends and stuff like that.
Go rent a movie.
Renting a movie.
Read a book.
Okay.
Ride a bike.
You like to ride a bike?
Do baking, bake cookies.
Okay.
There's many things.
To try to have some balance in your life and not focus
all on
entirely on work. Do you ever use where's your support system, or who do you turn to outside of work to help with stress relief? Is there anybody that can help with that piece?
I turn to my husband, of course. He doesn't always want to hear it, but he's pretty good. And if not, then co-worker is usually the best way to,
Okay.
go on break and forget about it, go downstairs, get something to eat, and whatever.
Okay. I'd like in closing to ask you if you could give, you've all had lots of experience as nursing assistants in these different settings, and you've seen nursing assistants come and go, some quickly, some you have stayed longer, and obviously there's a difference between why some stay and why some leave so quickly. And I'd like to ask if you have some advice for nursing assistants coming into this profession of how they can have a little bit better coping of stress that they might get on the job. What works?
You know, you don't want to be afraid to ask questions, ask for help. And I know in the class they only give you about 2, residents at a time to take care of, and then when you get out working, it's about 8 or 9. So you might want to ask for a longer orientation so you can get used to having a heavier workload. And
Time management is important. You need to learn how to manage your time. Definitely take your breaks. Take your lunch. You have to take care of yourself as well. Make sure your patient's safe, but take your breaks and, take your time for yourself.
Okay.
I think it's important that when you're taking care of these people, you realize the good feeling you get, and that you make sure you treat everyone as it could be your mother or your father. And if you are short of staff, don't beat yourself up because you can't do exactly everything that needed to be done. But just do your best you can.
Okay. One of you talked earlier about being asked to work overtime. I think that was you.
Yeah.
What advice could you give to people if they're asked to do extra time and
don't overextend yourself. Don't be afraid to say no. It's real hard for me to say no, but it doesn't take too many times to realize how much more stressful it is when you work overtime, and you get burnout real quick.
All right, and in closing, I'd like to ask why it is that you chose this job, and why is it that you stick with it even though it is a stressful situation?
Just taking care of people, it really makes you feel satisfied and good about yourself, and to know that you can help people. And
It's fun to see all their different personalities. I think that makes or breaks the profession. It's a fun job, and it can be stressful, of course, but it can be a lot of fun. There's definitely more pros and cons.
It's a great feeling of satisfaction you get, knowing you might have made a difference.
Great. Thanks, gals.
You're welcome.
Appreciate your coming today.